Well, good afternoon, everyone. It's right at noon, and to respect everybody's time, I think we'll go ahead and get started. But hello and good afternoon. I am Brandy O'Bannon. I'm the Executive Director of the Lebanon Community Hospital Foundation. Welcome to today's Town Hall. We are grateful you joined us to learn more about this significant project in Sweet Home, which will greatly increase access to healthcare in our community. We encourage you to use the chat feature throughout the presentation to make any comments or ask questions. We will address the questions at the end of the presentation. Today's Town Hall is presented by our Pride partners A&W of Sweet Home and Murphy Company. We thank these local businesses for their generous support of this project. Our presenters today are Marty Cahill and Milt Moran. Marty has served as CEO of Samaritan Lebanon Community Hospital since 2015 and has been employed by Samaritan since 2007. Milt Moran is a resident of Sweet Home, the president of Cascade Timber Consulting, and serves as our chairman of the Samaritan Health Services Board of Directors. He's also a member of our local Lebanon Community Hospital Board. We are proud that Milt is also a co-chair of our foundation's Sweet Home Clinic Fundraising Committee. As a brief orientation to today's topic, I wanted to share that the Sweet Home Clinic project is one of several initiatives included in our Samaritan Foundation's Stronger Together comprehensive fundraising campaign. Stronger Together features local initiatives to improve access, build community, inspire hope, and leave a legacy of generosity in support of Samaritan's nonprofit mission of building healthier communities together. On the screen, you'll see some of the examples of our campaign initiatives across our region. More information about all of these initiatives are also available online at samhelp.org/Stronger Together. Again, thank you so much for attending today. Welcome. And now it's my honor to introduce Milt Moran to share. Welcome, Milt.
Thank you, Brandy. So great opportunity today to visit everybody about what's going on in Sweet Home. I'm pretty excited about it. A little history here. We go back to a time when Health Committee in Sweet Home got together with the Comp Northwest students over here at medical school to do some community outreach and some surveys. And one of the things that I was really shocked by when we got together and talked about the results of that survey was that a lot of people in Sweet Home use the Sweet Home Fire and Ambulance District as their health care. And that was quite concerning. And so we knew as a healthcare system and as a community that we really need to do something to get better health care for everyone in Sweet Home. And, you know, I don't think about too much because I drive all over the place, but for some folks, it's really hard to drive from Sweet Home to Lebanon, and it's a difficult thing and may not even be possible. So this is a great opportunity. This is something that we really are excited about and looking forward to talking a little bit more about it here this afternoon. As you can see, the old hospital, the old Langmack Hospital, that was it's still a good place, and we're going to be continuing to use that. We're going to put a couple of $1 million into that facility, and it will be a great place for occupational health and physical therapy and some of those kinds of things. So we're excited that the new building to the east up there by Wiley Creek will be a great place moving forward. So I believe Marty's up next. Is that right?
Yes, it's right, Milt.
There you go.
Thank you, Milt. Again, Milt serves on our Lebanon board, and we're really lucky to have him involved in this project because every couple of years, the chairman of the SHS board rotates, and we happen to have Milt as our chairman of the board last year and this year. So really a great timing for us to have local support from our board and from the SHS board. So again, thank you, Milt, for introducing this. On this slide here, as Milt said, when we looked at trying to provide services in the community and the health committee that came out of Sweet Home, they were asking us to step up and do more. We just weren't in a position, 4 or 5 years ago to do that. But in 2020, I went back to the city and I asked them, if we were to move forward, what are your concerns? What would you like to see happen from a healthcare delivery model in Sweet Home? And what they said is they really need an urgent care. There's folks leaving the community, behavioral health was a concern for them. Memory care to try to coincide with what's going on at Wiley Creek, long-term care, and physical therapy. And the nice thing about this list is those are all of our core competencies. Those are the things that we do. The other thing about this list too, when we look at what Sweet Home was asking for, this is probably not much different than any community in our 3 counties, but I'd say any community in the country. So their ask or their desire for their vision was not out of bounds. It wasn't something that we were unfamiliar with. So we've got what they wanted, which were those 5 areas. And we think that we're going to be able to match up with those 5 areas with our partnership with Mosaic, who purchased Wiley Creek. Next slide, please. So here's the current clinic. Here's the staff. You can recognize them through their masks, I hope. And over the last couple of years, that's probably about all you've seen of them as well, with their masks on. But we have an excellent staff there. We like the location. The unfortunate part of that location is that the footprint is the footprint of the building, and we lack parking. So if we were to make the building bigger, we would lose parking. So we're really kind of just lacking space there to move forward. The good news is that space is going to continue to be held by Samaritan. We're gonna again do a remodel of that space, or refresh on that space, and we'll see that physical therapy, rehab services, and a number of other things that we haven't quite identified yet that will not necessarily go into a rural health clinic that we're building brand new for this clinic, but we'll have an additional 6,000 or 7,000, 8,000 square feet to again expand services in Sweet Home. Next slide, please. Yeah, so when we look at it right now, the current state of the clinic, if you're an established patient, we're talking about 18 days scheduling lag, and 18 days in a clinic, Monday through Friday, we're talking nearly 4 weeks to get a slot. And new patients, we're talking 40 days to get a scheduled slot. That's 8 weeks. That's a couple months to get in to see a clinician, and it's been as high as 120 days. So again, when we start looking at this, it's not insignificant. Sweet Home current clinicians have about 7,500 patients, and right now, no clinicians are taking on new patients except for the Medicaid population right now. So again, a lot of good reasons why where our current state is not where we need to be. So look at the need. In 2010, the population was just under 9,000. You can see in 2020, it went up about 2,500 residents, and to just a little under 10,500. So again, the growth is there. It's going to continue to grow. And if you look at the city issued 350 building permits in 21, 27%, 28% increase from the prior year, and they had 274. So you can see that from an affordability perspective, and I think from an availability of space, Sweet Home is becoming a place where people want to live. It's not a hard commute for folks going into Albany or potentially into Corvallis to work, or even down to Eugene. So it's becoming an untapped resource that is now starting to become tapped. So people are finding it and they're wanting to live there. And so when we look at it, building healthier Sweet Home together, you see who are we going to benefit here. And you see the chief from the fire department, it gave us his quote. You can read that, but it's definitely important for the quality of life for the folks to live within Sweet Home, to receive care within Sweet Home, again, so that they don't have to leave the community. That community has what it needs. And again, this will benefit the who is the citizens. The what is the 15,000 square feet that we will be building new. And that number is now 17,000 square feet. We'll talk more about that in a little bit. The new clinic will have an urgent care. Our goal is to have that open 7 days a week when we open. Again, that's the goal. We still have to hire some folks for that, but the goal is to have urgent care 7 days a week, but for sure to be there 5. Anticipated groundbreaking is the summer of 22 this year, July or August, when we start looking at getting the building designed, getting it out to bid, and then all the things that are happening around the country. When you look at wildfires in Colorado in the wintertime, California had a wildfire just a month ago in the middle of winter time. You look at the hurricanes that go along the East Coast. Resources are really, really limited. So again, trying to get everything that we need and the contractors to do the work. We're hoping again for the middle of the summer, and the why is so that we can take care of those community members in the community in which they live. The project mission statement here, which is a great mission. You know, the Samaritan's mission statement is to building healthier communities together. What we really want to look at here is for this project, you know, Sweet Home Family Medicine Clinic will be a source of pride in delivering consistent access to reliable, patient-centered whole health care to all members of the community. So again, the vision of this is to try to be all to as many people as we can. Again, focused around physical therapy, behavioral health, urgent care, and primary care. There's the group that helped with the sale of Wiley Creek. We've got some board members that are there in this picture. We've got our board chair, Randy Springer, there, Doug Boyson to the right of the easel, myself. Milt is standing between Doug and I, so we've got a good group there. Marcia Philpott to the left, and so yeah, we've got a good group of folks that are here as well. So, and Debbie is there next to Chairman Springer. So that's the group that was part of getting Wiley Creek sold to our partner Mosaic, and is also the team that's helping to move us forward. Maybe the one group that isn't identified in this photo that we definitely want to identify and make sure we keep them in the forefront with us is the Samaritan Medical Group. Again, that group will be helping us in the design, and they'll be running the clinic. So they're not in this picture, but SMG is definitely integral to the design of this clinic as well. This is the campus as we see it out at Wiley Creek. And if you look up into the top left corner, you'll see where the clinic space will be. That's where we're going to do it, right on the corner. There's a parking lot. You see a heli-pad. That's been a big ask from the community for a long time. We've got loggers in the woods. We've got people recreating in the woods. They're trying to get onto the football field to land helicopters or anywhere else they can, having a designated landing zone. We will be able to land helicopters from any private party, from Life Flight, the Coast Guard. You know, it's not going to be it's our landing zone, but it's a landing zone for a resource for the community. So whoever needs to land a helicopter, they can land on our landing zone there, and hopefully we can get people out of the woods quickly and get them in the back of an ambulance or urgent care. So again, that's a great addition for the Sweet Home community to have that designated spot there. Below the landing zone of memory care and over to the right, again, some more growth for assisted living and independent living. So Mosaic is looking to do a lot on this campus as well. Here's what that clinic looks like. When I told you that we went from 15,000 to 17,000 square feet, you'll see in this is just the layout of the clinic on that corner lot. The two things that are new that were not in the old clinic, pharmacy. We're gonna have a retail pharmacy out there. We find that with urgent care and our primary care, having a pharmacy that our patients can access and our employees will be very beneficial to the community. And then we've also had a co-location with Capital Dental, where they had one chair in our current clinic. They want to have an office there now. They see the value of Sweet Home and the unmet needs. So they're going to take 1,000 square feet and rent that from us. And pharmacy is going to add 1,000 square feet, so we have the pharmacy. So we're going from 15,000 to 17,000 square feet. So that's the growth of 2,000 square feet. But again, we'll build it and then lease it back out. So great resources for the community. Again, this is just a quick layout of clinic rooms. This is probably more important to our clinicians and our clinic leadership to make sure we lay these out appropriately. Access to their office space, restrooms, lab, and all those things. So that's just the breakout of what this what the 17,000 square feet will look like, color coded for primary care, break room, dental care, pharmacy, and urgent care. Those are all the players in the space. That's what the space will look like. So here's a rendition of what that space, what that building will look like. It's a one level. We decided to go with one level. We have 4 acres to build on. We want to be up by the hospital and 17,000 square feet without an elevator and all the things that go into adding a second story. We found it to be easier to make it a 1-story building for access, convenience, and quite literally presence on the highway and on that corner lot there. So one level, that's what the rendition right now. It's going to look very similar to this, but maybe not exactly like this. And then the interior lobby and waiting room. I hope you see that there's going to hopefully be a healthy amount of wood accent within the building. We've heard from the community. We've heard from our patients. You know, we're old milling towns, old milling community. We've got a lot of partnerships with Cascade Timber and other timber companies within the community. They would really like to see 21st century technology with wood laminates and things of that nature. And so, again, our goal would be to try to use as much wood accents and structural wood as we possibly can. Again, we'll be looking for partnerships with those folks to make sure that we can maintain the cost of the building where it's at, and also accent it with 21st century technology. And I think our partners are strong, and I think they want to see this technology in the building. It'd be a great showplace for them to show what they can do, and for us to actually show the community support for our local partners. So what does it look like for space? We're currently 10,000 square feet. Well, we will be remodeling that for PT. They're probably going to take about 3,000 square feet, so a lot of space left there. New clinic, 17,000, 6 providers. We can grow to 9 providers. That includes urgent care, but we still have opportunities to grow, which is very important in this community based on the number of new builds that we showed you, new buildings, houses going up in Sweet Home, apartments and houses. You'll see that there's 11 exam rooms. It's going to go to 18. When we look at 18, our exam rooms can be as small as about 90 square feet up to maybe in our current clinic, 80 to maybe a little over 100 square feet. These new clinic rooms will be a little bit bigger than that. They'll be about 11 by 10 or 110 square feet. So about 10 square feet more. The other thing too is we'll have pocket doors and some other things that will actually make the rooms bigger. We won't have to work around doors closing and such. So a lot of opportunity. The rooms will not only be bigger, but they'll feel bigger. We have 4 walk-ins right now for a walk-in clinic. We're going to move to an urgent care that will have 7 rooms. We currently have Monday through Friday, 8 to 5. But again, the goal in the future is to be open when our patients need us. So I don't know if that's more hours in the day, you know, opening earlier and staying later, or does that mean opening up on Saturday for primary care? Maybe both. And the goal would be to have urgent care 7 days a week. So a lot of growth and a lot of opportunity with this new space, this new clinic. Enhanced services, as I told you, we're looking at retail pharmacy being in there, dental office, lab there, behavioral health. Again, the difference when we look at behavioral health folks will sit and talk with our patients that have chronic disease and how to manage that disease, newly diagnosed diseases, diabetes, maybe cancer, any number of things that could be newly diagnosed that they're currently living with. So again, having a behavioral health presence there is going to be very important. Heli-pad, telehealth. We're looking at having the building ready to go for telehealth, so that we can potentially start to bring psychiatry out to Sweet Home, at least through a telehealth mechanism, so that they can at least get an initial appointment or follow-up appointments. Again, telehealth could also be utilized around orthopedics, around cardiology, any number of specialties as we continue to grow our telehealth capabilities. Technology-wise, we have it. We just need to hire the professionals, the doctors, to be able to provide the service on the other end. And again, we'll add at least 1 new clinician when the doors open to meet the needs of the community, and 2 or more clinicians in the next several years. So again, we're able to grow as the community grows. And the results of the healthcare enhancements, again, Mosaic is working through right now the design and licensing of their memory care and expanded services. We're working on our on developing our urgent care capabilities within Sweet Home. Physical therapy, we've got the Western University and Medical School brought up PT and OT, physical therapy and occupational therapy. We'll be running students through there. Hopefully we'll be able to expand those services almost overnight when we get that space remodeled and start tapping into that resource. And then a brand new family medicine clinic with more providers and telemedicine. The time frame. Wiley Creek was sold in October. As I said, we're looking to do the design work right now, and July, August, sometime in that time frame, we really are hoping to break ground on that clinic on Sweet Home's or on Wiley Creek property there. Have that done, sometime in 23, depending on when we get started, and then start the remodel of our current clinic when we get everyone moved out. I'm not going to hand it back to Milt.
Okay, thank you, Marty. Just want to talk right quick about the campaign committee we have in Sweet Home. So myself and Miriam Swanson are co-chairs. We have Fire Chief Dave Behringer, Bob Dalton, local businessmen, as well as Steve Hanskin and Larry Horton. Larry Horton's been very involved with the health committee in Sweet Home. We have Wendy Melcher, a longtime Sweet Home person. We have Megan O'Connor, who is a PA there at the Sweet Home clinic right now, and she's been very instrumental in working with us on the planning and the fundraising. Have Debbie Paul, who is the Lebanon board member and also foundation board member for Lebanon. Marcia Philpott, who is a long-term community member and board member here at Lebanon Hospital, and Ray Towery. And you can see a picture there we took a while back in nasty weather of the group. So the importance of, we really feel it's very, very important for our community, and we want healthcare to be where folks live, and that's really, really important. And as Marty explained, expanded times and expanded services, and it also lessen the impact on our emergency response. Right now, our ambulances and Sweet Home firefighters are working a lot of hours and putting a lot of miles on our ambulances, and we're hoping that this is really going to help them out and make them more efficient, because I often hear we have 1, 2, 3 ambulances at a time bringing Lebanon in to help out, and hopefully folks will be able to go to the new urgent care and be taken care of rather than having to wear out our ambulances. And we do have space to expand as we move forward. We have the things we have going on with Mosaic are very, very good, and it's going to be a wonderful healthcare campus. And it's definitely a significant investment for Sweet Home, and I'm really feeling good about that as president of Cascade Timber as we move forward with this new structure and services we're going to be able to provide. Brandy, I think you're up next, if I'm not mistaken.
I am. I'll cover the next couple slides. So we just wanted to talk about the fundraising aspect of the project a little bit, and thank you, Milt, for your leadership and advocacy of this project. I also want to thank Milt and Cascade Timber Consulting for being a major donor to the project, along with other local businesses and individuals. We're just very grateful for the support we've received. I did want to share just a quick story. I was able to talk to one of our patients at the Sweet Home Clinic recently, and that person gave me permission to share a few ideas and quotes. They said, "The Sweet Home Clinic is bursting at the seams. It's been bursting for a long time. Due to our location, Sweet Home gets forgotten. We need more doctors. We need an urgent care. We need a clinic open more days and more hours. Often, we have to drive to Lebanon for health care. That can take 20 to 30 minutes. And if it's serious, that's just too far. I'm 100% on board as a community member in support of this project." I really want to thank that person for letting us share. And just if this project resonates with you for any similar reasons, maybe the benefits it will provide long-term, an understanding of the need, your excitement about these enhancements and access to care, we really just want to introduce the opportunity to please consider joining us and participating as a donor in this fundraising campaign. There are many ways to give, a few which are highlighted on the screen, and all sizes of gifts are needed and appreciated. For some community members I've worked with, it's been important to their family or their business to have their name listed on our donor wall. This is a one-time opportunity. It's going to be a kind of a founding donor wall in that beautiful new lobby. And some have made gifts in honor or memory of loved ones. And they have really explained to me that they've given so that their children and grandchildren will see their names when they walk into these clinic doors. And in doing so, will understand that supporting local health care for their families and neighbors is a value that they deeply held. So we just wanted to introduce this idea that more information is available online. We've shared our website a couple times on the screen and in the chat. So information about the fundraising campaign is available at samhealth.org, Sweet Home Together. If you'd like to learn more, feel free to reach out anytime to myself, to my foundation colleague, Christy Duncan, to Milt, or to any of those fantastic Sweet Home committee members that Milt highlighted earlier. We'd be happy to share materials with you, meet with you individually. So thank you again for joining us today for the town hall. Now we want to turn it back to Marty and start to address some of the questions. Many of you submitted questions in advance, and we really want to thank you. So this is a summary of some of those. We'll try to run through those pretty quickly, and then Marty, maybe once you address these questions, we also have some in the chat that I could read off to you.
Perfect. Yeah. Why don't you, once we get through these real quickly, then if you read them off, I'd appreciate it. So how will patients who do not drive or have mobility issues access the clinic? It's a great question. We're moving the clinic. So folks that live near the current clinic have had greater access to walk or to get there. We're moving a couple miles down the road. Luckily for us, Sweet Home has increased the public transportation, so it's on the bus route to get down there. Again, we'll start to work with those patients who might need a non-medical transport, and then make sure that we tap into those resources. And again, that's something that for the patients who can't afford to do things or might not have insurance, we maybe run that through the foundation. But we'll look to make sure that we have people can get to our clinic in any way possible, and we'll try to support them doing that. How many new jobs will be created? Well, I think from Samaritan's perspective, we've got a fully staffed clinic right now, so they'll all move down to the new space. As we add urgent care providers, we will add support staff. But I think when we look at this, the number for us moving forward, at least in the next couple of years, is not a significant number. It could be 3 to 5 people. I think the one thing that's real promising for the community, though, is as Mosaic builds a 24 to 48 unit memory care unit there on the campus, and they expand some of their services. I think you're going to see a very robust healthcare campus with the creation of jobs both by Samaritan and by Mosaic as they expand services as well. What type of clinical staff will be employed at the clinic? We'll have primary care docs. We'll have all the support staff from medical assistants to the people that do registration, signing you in, lab people. There'll be an x-ray machine there. So again, all the same types of folks that we currently have. And behavioral health, we'll hopefully have a behavioral health psychologist there to help with those services. And then a nurse or a medical assistant to help with telemedicine. So again, we can check you in, do all the vital signs, and then get you connected to a provider through telehealth. What diagnostic and lab services will be available? X-ray and lab. We'll be doing blood draws and X-ray there. There should be an ultrasound machine there as well. But the same types of technology you see today, we should have the same types of things there. How will traffic be affected on 49th during construction? I don't think there'll be much disruption to traffic around there. We've got 4 acres to build on. I think where the disruption will come in is when we cut the driveway out to 49th to come into the clinic. There will be some disruption around that, cutting that out, cutting the curb, putting in sidewalks, putting in the driveway. There could be some disruption towards the end of the project, but I think that'll be minimal. I think most, if not everything, will fit onto our 4 acres. And again, the building and parking lot will take up about 1.5 acres. So we've got about 2.5 acres on site to build and store things. So I think we should not have a lot of disruption. And what about ongoing traffic by the urgent care? The urgent care is gonna, won't be open. I think we're open till 8 o'clock in our current urgent cares, or maybe 9. Again, folks going in there, probably very similar to the coming to our current clinic right now. Might be a couple hours longer because we're closing at 5 now, but I don't see a lot of additional traffic coming in there. Much different hours, except for if we're open a little later, and maybe on the weekends, the folks coming in, but I don't think that's significant traffic. But there will be some additional folks driving there. Who will operate and provide the helicopters intended for Sweet Home Clinic? Again, those will be Life Flight, Reach. Coast Guard could come in there. I don't know how often they'd ever do that, but the Coast Guard could land there. They occasionally land at the hospital already, just to get their pilots familiar with all the landing zones. If any of the timber industry folks have helicopters that they might be using, but again, we're just building the landing zone. We're not trying to build our own fleet of helicopters. We're just trying to provide a place for people to land. Will there be a Sam Fit? At present, there's no plans for a Sam Fit. We've got one here in Lebanon. There's a gym already out in Sweet Home. I think that are meeting the needs of the community, and potentially a Sam Fit, but I don't see it right now or in the near future. And then how will you select a general contractor? That's a great question. We will send it out to right now. The architect is designing the building, getting all the blueprints and all of that put together. We'll then put a packet together. We've identified four general contractors that we are going to send it to. They will send back a closed bid. We will then have a team of folks that will look at that are experts in looking at those bids, and then we will select a general contractor from the four with the most competitive bid. And again, competitive can be a lot of things. Price is a very, very big part of that, but ability to get the job done in the time frame necessary, and a lot of other factors. But the most competitive bid will win. What opportunities will be available for medical students, including PTOT students, and how should the students express their interest? Another great question. We've partnered with the medical school since they've been here for 12 years. Samaritan has a department over in Corvallis that takes care of graduate medical education. Folks have to go through there so we can centralize who's coming in, make sure that they have all their vaccinations, all the things that they need to have to be involved in the delivery of care. And that will include PT and OT. We're partnering with them within the building now at the school. And again, we take a lot of their students. I think Samaritan is probably the largest or second largest in terms of taking the largest number of their students on an annual basis. So we'll continue to partner with the medical school and the PT school. How does this project address mental health, behavioral health needs in the community? Again, getting a psychologist out there to help with behavioral health is going to be very important. I think we've had some out there in the past. And around mental health, I think that at the very least, the telemedicine will be very important, so that we can start to get people a meeting with a psychiatrist who might be in Corvallis to lessen the drive for either the physician and or the patient. And I think that'll probably be the first step, is the telehealth, the telemedicine opportunity. And as we continue to hire more psychiatrists, again, there's a large shortage of that profession. But I think telehealth will be very helpful. What services will be available for unsheltered neighbors? Again, we'll have the urgent care there. They'll be able to access care. We're not building any shelter space at our facility. We don't view that to be our core competency. That was one of the reasons why the Creek was sold. A different issue, but still some of the same, that if we stay within our core competencies and find community partners, that's what we found to be the most beneficial. And again, with the unsheltered neighbors in the community, if they need to access care, we'll have an urgent care 7 days a week for them to be able to access care. Again, it's our mission as a not-for-profit organization. we'll work with those folks as well. And will exam rooms be larger than current exam rooms? I think I mentioned earlier, they're going to be about 10 square feet bigger than the largest room, and maybe 20 or 25 square feet larger than our smallest clinic space right now. So again, the rooms will be larger, and with pocket doors instead of swinging doors, they're not only they appear to be bigger, they're just going to be more functional space within the new clinic space. All right, Randy, I'm ready for some questions. Additional.
Sounds good. Thank you. I think we addressed some that were in the chat, but I'll read off a few. Will there be an opportunity for occupational therapy services?
We'll have potentially. We'd like to see getting OT out there. I think there's another OCMED, some dealing with the truck drivers, making sure that they might have some services out there, and then any other thing around OCMED. Again, that's another really hard to recruit specialty, but it's not off the table. If we can get people hired, and then again get out there at some, I don't even know what the cadence would be, once a week, once a month. We'd have to look at that, but occupational OT will be at the old current clinic space. OCMED may potentially get into the new space.
Great, thank you. A couple staffing questions. If you could talk a little bit, I think this is in terms of recruiting for clinicians, Marty. So a question about where are the doctors who will be staffing the services coming from? So the new clinicians, I believe, that you're planning on hiring.
Yeah, great question. I think when we look at primary care, we'll be hiring for that. We'll be looking for new hires to want to move into the community and want to live and work in Sweet Home, just like our current clinicians do. So from a primary care perspective, we'll be hiring new folks. And when we look at going from a walk-in clinic to an urgent care, we've got Rick Parrish, who's out there right now, doing a fantastic job managing that walk-in clinic for us, and he'll be moving over to the new clinic space. And then when we look at urgent care, we've got urgent cares in all of our communities. Again, that's a pool of providers that can go from site to site, whether they're in Lebanon, Albany, Corvallis. We have a number of urgent cares in these communities. So they'll be part of the urgent care team. Some of which may choose to live in the Lebanon Sweet Home community, some of which will be rotating around the valley and may live somewhere else. But again, we're going to have to hire more providers to provide urgent care for expanded hours and expanded days. I think Rick Parrish is not going to want to work 7 days a week, 12 hours a day. So we'll have to hire more clinicians to support him.
Thanks, Marty. There was someone that had heard that perhaps some doctors in Lebanon have left because of contracting and maybe not allowing latitude as a doctor. They asked, how are we addressing those concerns?
Sure. I mean, we've had the development of Samaritan Medical Group over 3 years, over the last 3 years. I actually think that the Samaritan Medical Group has stabilized the community and stabilize the physician and clinicians across our 3-county region. I think that we've had folks that over the last time in eternity, but the last 25 years of Samaritan and prior to them, people come to a community and like being here, and then sometimes they come to the community and it's just not a good fit. And again, I think having the Samaritan Medical Group involved helps us create that culture around our clinicians, and with the support of the hospital's administration and Samaritan Medical Group, we're recruiting a lot of good docs in the community and across our 3-county region. And I think that moving forward, we will always see some folks that for whatever reason might not want to stay in the community. But I do think that we've stabilized the medical group and within the community, and we've got a great foundation to continue to build on.
Thank you. And there was a question about, can the new clinic space include a negative pressure room to help prepare for future pandemics?
Great question. I'll have to bring that back to the team. Is it possible? Yes, it's definitely possible. And maybe it's done. That's a little finer detail than something I've been close to, but I'll ask about a negative pressure room or two for sure. I can ask about that. Great question.
I think we've addressed most of the questions that I see in the chat. Marty, if you or Milt have any other things, comments that you'd like to say before we close, and then certainly to the attendees, we still have time. So if people have further topics they'd like us to address, we're happy to.
Well, Milt just gave me a thumbs up, and he wanted me to thank all of you for listening in today. He's very appreciative of that, and I got to tell you, I am as well. Community interest is important. Your feedback is super important. We can't fix what we don't know. Understanding your concerns has been very helpful. Your questions have been very thoughtful. I hope that we've brought to you answers to most or all of your questions. And again, I want to personally thank you for your partnership in this process. And I look forward again to our continued partnership and growth in Sweet Home. And that, again, I hope we meet all the needs that you folks have for your community. Thank you.
Wonderful, Marty, and I would just second that. Again, thank you so much. We're really excited about this project. We're excited about the attendance today. Ways you can help us is please just continue to spread the word. We want everybody in Sweet Home to be looking forward to this project. We'll be having more information about our groundbreaking ceremonies this summer. We have a great website that we'll make sure to keep updated. Thank you for the active chat. We'll make sure to respond as much as we can and post updates on the website and certainly share out this recording as well. So thank you all for attending. We appreciate your excitement about the project and stay tuned. Have a great afternoon.